see you all. Just to review what's going to happen in just a couple minutes, we are all going to file into the sun, the horrible sun, and stand with the hospital behind us, facing the porch. Jacob is going to kick us off, and then we'll pass through the program of speakers. Nicole will close us, and then the group will complete with community supporters, with politicians, with faith leaders, with residents. We got it all. We'll file in to deliver the petition to Stephen Leffler's office. He's not there today, but you know. We're just waiting for Migrant Justice to join us. They should be on their way coming here right now, and then we'll get started, okay? If you need to step inside to try to cool off as quickly as possible, do, but we're going to be getting started in just a couple of minutes, very, very soon. Introduce yourself to someone you don't know if you have not yet.
My name's Nicole. Hi, Nicole. I'm Kelsey. I don't know if we've met before. We met earlier. Poppy, if you don't want your backpack to carry, I'll put a stash of backpacks right there that Harris is going to like throw in a wagon.
Okay.
It's up to you.
Okay. Yeah, we have a
Oh yeah,
little
because we're probably
bags.
not going to leave.
Yeah, we're going right.
We'll go right to party.
Yeah. And management's coming at 4:15 instead of 4 because like, this is going to be way too close.
Right.
I'm going to be like running down the hall.
Step inside for a minute.
I just had the temporary conflict. Slowly unfreezing.
I don't either.
I'm in the right place then. We have a doctor.
When I said that last time,
Oh, you don't want to say it. I do love people, but also.
I've seen you go back in there. I feel like I'm so but I can keep my backpack and I don't think
Thank you everyone for being here today. My name is Jacob and I'm the president of UVMMC Support Staff United.
And I'm Nicole, president of the Vermont Federation of Nurses and Health Professionals.
We're here because Vermont's healthcare is at a crossroads. Patients here pay the highest healthcare costs in the country, but that money doesn't make it to nursing assistants or imaging techs or schedulers. That money disappears somewhere in the bureaucratic machine of UVM Health between human resources, lobbyists, and public relations positions. For years, the network has mismanaged millions and millions of dollars, and now they're attempting to balance their budget on the back of workers and patients. We're here to say enough is enough. We need a real leader in healthcare, and we have a vision of what that leadership looks like. Over 4,000 union and community members have signed on to our Common Good platform. This platform is a series of articles that we proposed that would benefit not just our members, but all Vermonters. They include protections for immigrants, expanded safe staffing enforcement, and first-of-its-kind language which would prohibit the hospital from using its presumably limited resources to block a state or national universal health care law. So far, management has refused to bargain over any of these proposals and instead has presented takebacks or weakened language on safe staffing, job security, among other protections. We're delivering this petition today to the office of Dr. Stephen Leffler to demand that management respect our time and bargain with us on these important priorities. Next, I'm going to pass it to our resident colleagues at CIR who have just been through a contract fight of their own.
Thank you, Jacob, for the introduction. Hello, everyone. My name is Dr. Brandon Lung, and I am a resident psychiatrist physician here at UVM Medical Center, and I am a proud member of my union, the Committee of Interns and Residents at CIU. As doctors, we come into our hospital to take care of patients every single day as part of a team that includes technicians, technologists, support staff, and colleagues across this hospital. Quality care is the product of an entire team working together, fully staffed and fully supported. That's why CIR members are standing here today with our coworkers, delivering this petition to UVM Health leadership. Technical and support staff are demanding a contract that supports their ability to carry out their jobs with safety, dignity, and respect. But beyond that, they are demanding a contract that supports our entire community. They are bargaining for the common good. When staffing grids aren't enforced, when positions go unfilled, when the people holding this hospital together are stretched too thin, patients feel it, care suffers. And we know because we're the ones at the bedside. We are asking UVMMC to commit to real, enforceable, safe staffing standards. We are asking them to support Act 48 and the promise of healthcare as a human right for every Vermonter. We are asking for wages that let the people who care for this community actually afford to live in it. At UVM, each of us workers are part of a strong community and have built a coalition to advocate for ourselves and our patients collectively. In our own contract fight, these workers came to stand with us. We had their support when making our own immigration proposals during bargaining, so we are proud to be in this with them. For the first time, technical and support staff unions across this hospital are bargaining together. That means our voices are louder together. I want to make it clear that we resident physicians stand with technical and support workers every step of the way in this fight. Because every single one of our jobs is essential to patient safety. This isn't just about one contract fight. This is about the future of healthcare in Vermont, whether it's built on quality, equity, and respect, or built on cuts, as UVM seems to insist on. UVM has a responsibility to meet the needs of the people of Vermont. We are delivering this petition today because our community is watching and our community stands together. Thank you.
Thank you, Brandon.
And thank you for your solidarity. Next, we'll hear from gubernatorial candidate Amanda Janu.
Thank you so much, everybody who's here to stand in solidarity with our nurses, our healthcare workers, our union members who are using their collective voice and power to fight for their rights, for their patients, and for a better healthcare system for all of us. I'm Amanda Janu, and I'm running for governor because I believe that healthcare is a human right, and that every Vermonter should have access to high-quality, free healthcare close to where they live. And that starts by making sure that the people who provide that care are respected, supported, and able to do the work that they love, caring for their patients. Our healthcare system is collapsing, and now is the moment that we must move to a universal healthcare system. I'm an economist who has worked with governments and communities here and around the world, and it's time to recognize that a profit-oriented healthcare system is a terrible idea. As you end up with high healthcare costs and poor health outcomes because the system is designed to concentrate wealth rather than keep people healthy. It's time that we remove the profit-oriented insurance and fee-for-service structure that leaves our healthcare workers burnt out, underpaid, and unable to provide the relational care we need. As a patient at UVMMC, I've seen firsthand the extraordinary people who work here. When you're sick or when you have somebody you love in the hospital, it's the nurses, the technicians, the therapists, and the support staff who carry you through those moments. And they deserve a hospital and a healthcare system that values them, not one that asks them to keep doing more and more with less. At a time when Vermonters are demanding a healthcare system that is more affordable, more accessible, and more accountable, it is deeply concerning that UVMMC won't even commit to staying neutral on the question of universal healthcare. Our largest healthcare institution should be helping lead Vermont towards that stronger healthcare system, not standing in the way of us getting there. The truth is, our healthcare system is collapsing, and whether or not we like it, we're gonna have to make some major changes in the years ahead. The question is, who is going to lead those changes? as we can keep trying to put patches on this system that puts insurance companies, corporate executives, and financial interests first. Or we can build a healthcare system that prioritizes what actually matters, the health and well-being of our communities. My name's Amanda Janeau, and I'm running for governor because I refuse to accept that collapse is inevitable or that the best a governor can do is just manage decline. I know that Vermont can build a healthcare system that puts people before profit, prevention before paperwork, and care before corporate interests. And so I hope you will help me to get out the vote this Tuesday and join for this election party in the evening so we can celebrate this incredible movement that you have all worked to build to ensure that in Vermont, healthcare is finally treated as the human right it is. Thank you.
Thank you for your support, Amanda. And in addition, today we have Nikhil Goyal with us. Tanya Vyhovsky also is standing in solidarity with us in support, though she wasn't quite able to make it here over from work. But it's clear if we're going to address the root cause of the healthcare crisis, we will need leaders in all levels of government and on the ground, and we are so glad to have you with us here today. Next up, we know that UVM Health is one of, if not the largest employer in the state. They need to be making choices that uplift all Vermonters. A very straightforward way that they can do this is by joining the Milk with Dignity program, and we're so glad to be joined today by Migrant Justice.
Hola, hola. Mi nombre es Telma y soy parte de la comunidad migrante aquí en Vermont.
Hello, my name is Telma. I'm part of the immigrant community here in Vermont.
Y estamos aquí porque estamos en solidaridad con los trabajadores y el sindicato de la gente que cuida de la salud.
And we are here standing in solidarity with healthcare workers and with these two labor unions.
Es algo muy importante porque sabemos que están viendo por un bien común, no solo por sus derechos como trabajadores, sino también por los derechos de los trabajadores migrantes en el estado de Vermont.
And we are here recognizing that they are not only fighting for their rights as healthcare workers, but for the rights of all workers in Vermont.
Algo que están pidiendo en su petición también es que la leche que se sirve en el hospital sea leche que venga con dignidad y que reconozca a los trabajadores que están en la industria lechera.
One of the things that they are asking for is that the milk that this hospital serves and this cafeteria and to patients comes from farms where workers are treated with dignity and where their rights are respected.
Leche con Dignidad es un programa creado por trabajadores y liderado por ellos mismos, quienes a lo largo de los años hemos visto esto como una solución a un nivel grande donde podemos asegurar que realmente los trabajadores somos respetados.
Milk with Dignity is a program created by and for dairy workers, which is transforming the dairy industry over the long term to be one where all workers' rights are respected.
Por tiempo no puedo explicar tanto, pero queremos decir que la clase obrera no conoce fronteras y que por eso estamos aquí hoy.
And I don't have the time today to say everything that's in my heart, but I want to close by saying that the working class knows no borders.
It's so powerful to hear that despite the differences in our jobs and roles, we're up against the same basic challenges, being asked to work longer, do more, and do so with less. We're so glad to be standing together in solidarity. Now we'll pass it to Matt Guile, who can speak as both an educator and a candidate to these challenges.
Hello, I'm Matt Guile. I'm the librarian for the Winooski School District, a member of the Winooski Education Association Executive Council, and a candidate for state representative in Winooski. School workers and healthcare workers are facing the same attacks to impose austerity on our schools and our healthcare facilities. Our bosses are using the real affordability crisis as an excuse without addressing the actual underlying cause of that crisis. Our for-profit healthcare system, our for-profit housing system, and our for-profit system as a whole. These are extracting value from working people. But education workers and healthcare workers also share similar strengths. Our work is caring for those in our community, and that connection is so powerful. That's why we say educator working conditions or student learning conditions and safe staffing. Safe staffing. The Healthcare as a Human Rights Campaign is a coalition including AFT Vermont, my union, the Vermont National Education Association, and the Workers Center. And we are demanding the implementation of universal single-payer health care in our state. And this is the beginning of us embracing our common strength. My union, Vermont NEA, has members who are trusted in their communities in every legislative district in this state. And you, AFT Vermont, have members who can speak with authority on our healthcare crisis from your earned and lived experience. This is the shape of a movement that can carry universal healthcare all the way to implementation. We can address the conflux of crises we are in. Housing, healthcare, basic necessities becoming out of reach for working Vermonters. Electing state legislators and a new governor who are willing to fight for working people is a component of how we do this, but it's insufficient. Sending a few more folks to the State House to say, have you heard about universal health care? That might be a nice idea. That's not going to cut it. We need a movement with us, working people across the state standing in solidarity and using our power as workers, not to just ask nicely for small targeted concessions, but to make our demands undeniable. And our power is vast, greater than any hoarded gold, but only when we understand that our power of workers is not something that is simply granted to us. It is inherent in us, in our role as workers. Our labor is ours. And when we choose to stand in solidarity and withhold our labor, to strike, that is a power that cannot be ignored or brushed aside. And we can build that movement only when we realize that the fight for healthcare is not separate from the fight for public education, or for migrant justice, or trans liberation, for a livable climate, or the fight for a free Palestine. They are one fight, and they are our fight, because an injury to one, an injury to one. All right, repeat after me. Money for care and education. Not for war and deportation. Money for care and education. Not for war and deportation.
Not for war and deportation.
Solidarity, friends.
All right, thank you all so much. It is so powerful to hear these different perspectives because we know truly that this is more than just about 2 contracts. This is about the future we want for Vermont. We need a state we can afford to live in. We need dignified jobs, good schools, and high-quality healthcare. And it's going to take all of us to get there. We have just 2 bargaining sessions scheduled before our contract expires on August 13th. We hope that management will return to the table today with proposals that are respectful of our members' time. If they don't, we'll continue to build pressure. We've just submitted a 10-day notice for an informational picket outside the hospital. This isn't a work stoppage, but it's another big step to take. We're not taking this step because we want to. We do it because we see we have no other choice. The hospital right now is saying that Vermonters need to accept that care will get worse. We find that unacceptable. We, as healthcare workers, feel we have an obligation to carve a different path forward.
And we're so proud to be doing this with our full community at our back. This petition represents thousands of conversations about the healthcare crisis and values we hold as a community, and it's time to deliver all 150 pages of them. Now, we'll enter the hospital. We've been told Dr. Leffler is unavailable this afternoon, but we'll deliver it to another member of his administration, and then we'll head to the bargaining room. Are we all ready? Yeah. Let's go.
Very sweaty.
Hi. Hi. Sorry. Are you doing this water?
What's happening?
Hey, lady.
How you doing?
Yeah.
Nice to see you.
So
We have to make sure that no camera. I've been there since
I will let.
That's the main thing. It's a policy. Oh, really? Oh, I only taught the fall of
Anybody need water?
I taught at Wesleyan.
Water. Hey. Hi. Is that your camera? Camera? But there are.
Sure, yeah. Now I'm married
We're running this at 4 o'clock. So I'm Ruben. They want to go back. Hi.
Hello.
Peace out. Right.
Nice to meet you.
We'll keep it straight.
Yeah, no worries.
Walking that way.
I am the president of UVMMC Support Staff Unit.
So, what made you decide to organize this rally today?
So a lot of why we're doing some of these public-facing events, especially with our community allies, is to support our proposals, support the bargaining for the common good. Essentially, you know, it's not necessarily fair that it has to be the working people that have to fight for each other, but politicians, while we do have allies here, no one is coming to save us from Washington or Montpelier. We need to support our community in any way that we can. And if UVM Medical Center is the epicenter of the healthcare system in the region and the largest employer in the state, we seem to be the only folks willing to take them on and win concessions, not just for our folks, but for our patients and community as well.
Absolutely. I know you said during
Yeah, so beyond the decline of the American healthcare system nationwide, UVMMC is completely unwilling to even really have a conversation about ways that we could be improving conditions in our community. They're very, very hyper-focused on we can only bargain over the things that affect your very specific working conditions, but that's not really up to them. We can make whatever demands we want if it's the right thing for us to do and if our members support it. Yeah, beyond just these community ally protections that we're looking for, not just immigration protections for our folks and for folks around the state, it's also, I think enough is enough in regard to takebacks on safe staffing. Like they have made every proposal across the table in regard to staffing levels worse. That has never been done in the history of 20 years of labor organizing here in this at this institution. The fact that they would be they're more interested in removing already perilous staffing levels in favor of essentially not even being able to speak about these other issues is very it's very difficult to wrap your head around.
Would you say the biggest priority then is safe staffing?
Safe staffing is definitely our number one priority. We actually, during our initial bargaining survey, where we put out to all of our members, for the first time, and I think anyone had ever seen a labor union, wages were not the number one priority for folks. It was safe staffing levels and healthcare. And that's what our entire campaign is built around. It's why we're very focused in on supporting Act 48. You know, it's why we're focused on getting a safe staffing article with actual teeth in it. That's definitely our priorities.
And can I just double check, the contract ends the 13th?
It actually, I believe it ends on midnight on August 14th. So,
close. Yeah.
Essentially, yes.
Okay. That's all my questions. Ruben, do you have anything else?
No, I think just we're really excited that the community has been behind us, that fellow labor unions are behind us. This is, as far as I know, is like the first real campaign centered on communication among people that aren't necessarily workers at UVMMC. So it's been a really cool experience, and it's been awesome to see the amount of solidarity we have.
Thank you so much.
Yeah, thank you. Hello, everybody. We just finished our community press conference to support bargaining for the common good among the two unions currently bargaining with the UVM Medical Center. My union, Support Staff United, and the Vermont Federation of Nurses and Health Professionals. Their techs are bargaining alongside us. We had many of our community allies, both elected officials, prospective elected officials, migrant justice, folks from other unions that are not in healthcare. We had some of our colleagues from the resident doctors union over at the hospital, and it's all to say that we're all in this fight together. We are. This is the first time, this is, at least as far as I know, that there's been a real effort in this community by unions to not just bargain for our own very vital working conditions to take care of patients appropriately, but also to benefit immigrant workers across the state, also to put pressure on the hospital to stop spending money on lobbyists against universal health care. So much of what we're doing inside that building isn't just for us and our patients, but for the broader community as well. And that was what this was all about, and a way for us to get the word out and for our community allies to come together and publicly put pressure on the hospital before our contract expires in a little over a week.